Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case report that highlights the successful management of an early-onset, painful tibial nerve neuroma in a dog, utilizing an autologous nerve graft. This condition, though rarely documented in veterinary literature, can cause severe pain and discomfort in our furry companions. This report not only sheds light on the condition, but also offers a promising treatment approach. Our story begins with a 12-year-old, 21-kilogram, castrated male beagle who was referred for surgical resection of a grade 2 soft tissue sarcoma located on the medial aspect of the right calcaneus. To ensure tension-free closure after the resection, a reverse saphenous conduit flap was planned. During the preparation of this flap, an unfortunate incident occurred. The tibial nerve was inadvertently partially transected, about 70% of its diameter, as it emerged from deep to superficial in the mid-tibia. The surgeon meticulously reattached the nerve using two simple interrupted sutures. Initially, the dog appeared to recover without any neurological deficits and was discharged the following day. However, 10 days post-surgery, the patient presented with an acute non-weight-bearing lameness on the operated leg. Clinical examination revealed that the dog was experiencing severe pain in the area of the injured nerve, although no nerve deficits were apparent on neurological examination. To investigate the cause of the pain, a low-field magnetic resonance imaging, or MRI, examination was conducted. The MRI revealed an irregular tubular enlargement of the tibial nerve at the site of the injury, measuring 16 millimeters in length and 2.5 millimeters in diameter. The lesion showed specific signal intensities in T1 and T2 weighted images, raising suspicion for neuroma formation. Conservative treatment was initiated with oral analgesics, including gabapentin and meloxicam, administered over 11 days. Despite this, the patient's symptoms did not improve, and the dog continued to experience severe pain. Consequently, the owners were advised to consider microsurgical resection of the neuroma and reconstruction of a nerve. The microsurgical procedure began with the induction of general anesthesia. Perioperative medication included various analgesics and antibiotics. A medial approach to the right distal tibia was performed to expose the tibial nerve. A fusiform tumorous swelling of the tibial nerve, approximately 1.5 centimeters long, was identified as the neuroma. Prior to any manipulation of the nerve, local anesthesia was administered. The surgeons then meticulously resected the neuroma, removing all disrupted fascicles and surrounding scar tissue, while carefully sparing the intact fascicles. To bridge the defect, a 1.5 centimeter cutaneous saphenous nerve graft was harvested from the initial flap donor site at the proximal tibia. The cut end of the donor nerve was buried in soft tissue. An epineural suture technique was employed, using 3 epineural sutures proximally and 2 distally, with non-absorbable monofilament suture. The wound was then closed in a routine fashion, and a light full-limb bandage was applied for 3 weeks. The excised neuroma was then sent for histopathological examination, which confirmed the diagnosis of a traumatic neuroma characterized by disorganized axons embedded in collagenous tissue. The dog showed immediate signs of improvement, experiencing pain relief and weight bearing the day after surgery, with normal motor nerve function and sensation. The patient was discharged with carprofen for 10 days, and exercise was restricted to leash walks for 1 month. Follow-up examinations at 2 days, 2 weeks, and 4 weeks post-surgery revealed continuous improvement. By the last follow-up, 6 months after surgery, the patient had made a full recovery and was free from lameness. The owners and referring veterinarian reported a good cosmetic outcome with no apparent lameness or neurological deficits. This case highlights several important considerations for veterinary surgeons. First, neuroma formation should be considered in patients that develop pain and lameness following surgery or nerve injury, even shortly after the procedure. In this particular case, clinical symptoms were observed only 10 days after the initial nerve injury, which is earlier than typically reported. Secondly, microsurgical resection and autologous nerve transplantation using an epineural nerve repair technique is a viable method to treat painful neuromas and minimize the risk for recurrence in dogs. The use of a cutaneous saphenous nerve graft in this case proved to be highly effective. This nerve is readily accessible, has a purely sensory function, and is constant in position, making it an excellent choice for a nerve graft. Thirdly, While MRI can be a valuable tool in confirming the diagnosis of a neuroma and planning surgery, clinical examination and nerve blocks can also play a crucial role. In human medicine, it has been reported that patients who show instant pain relief following a local nerve block will respond to microsurgical neuroma resection. In conclusion, this case report demonstrates that clinical signs of painful neuromas can occur early after nerve injury. It also underscores the importance of veterinary surgeons acquiring microsurgical skills to allow for the repair of nerve injuries and the prevention of neuroma formation. To the best of the author's knowledge, this is the first report describing early-onset pain and successful microsurgical treatment of a post-traumatic neuroma of the tibial nerve in veterinary medicine. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.